Now I request Mrs. Nina Jolly to deliver the talk on the Renal CAiR project.
One fine day, when my father could not breathe comfortably, we realized after taking him to an emergency hospital that his kidneys had failed. A lot of learning as a patient, a lot of learning as a caregiver, and it went on for a few months, after which he passed away. And that hit me so hard that I realized that we need to do something in this space. Good afternoon, everyone. On behalf of Adharshila, I extend a warm welcome as we continue to enhance and enrich our program. Today's session marks an important step forward in that direction. Thank you very much. We look forward to an engaging and insightful session that strengthens our understanding and advances our collective mission.
Thank you again, everyone, for having me here. Nina, ma'am, for organizing this. Today we'll talk about our algorithm at St. Paul's Hospital in Vancouver. We'll talk about what some of these failure mechanisms are that we just had a brief presentation on. We'll talk about what our surveillance strategy looks like. Our patients who are referred are basically CKD patients with a GFR less than 15. In terms of our access algorithm, it's certainly AV fistula first. We do certainly provide AV grafts. We haven't found success with our upper extremity vascular grafts. We found they often go down either because of thrombosis, hypotension, or infection. We only provide lower extremity grafts once we've completely exhausted all endovascular and open vascular upper extremity accesses. We're looking for a fellow for 2026, so if any one of you have any interest in applying to Vancouver to our center, please feel free to come and have a chat with me after as well.
It was an excellent talk. This was beneficial for not only the doctors and surgeons out here, but the students as well.
We had a wonderful seminar on the vascular access surgery for the hemodialysis. We had Dr. Gautamn from Canada, who shared his experiences with the endovascular procedures, which is one of the integral part of the management of the fistulas.
These kind of sessions are very interesting, and we have been very delighted and elated to attend such sessions.
ऐसे सेशंस होने चाहिए और फ्यूचर में भी होने चाहिए कि जैसे नए स्टूडेंट्स आ रहे हैं, जो नए पढ़ के आ रहे हैं, जो जिनको 1 year हुए हैं या डायलिसिस या 2 years हुए हैं, उनको बहुत कुछ सीखने को मिलेगा इस टॉक से.
We feel very honored that today we have conducted this program, and in which many students have participated, our undergraduate students, postgraduate, and even our ex-postgraduate students who have been working as leading urologists in various hospitals in Delhi, they have participated today. And such programs are very good because not only are we raising awareness about AV fistula among our medical students, also nurses, technicians, and rest of the staff, but also making it we are actually sharing the knowledge with everyone out here that how important is the formation of AV fistula.
I think I'm very impressed coming from what I thought was a developed nation, and looking at how far you've come with how little resources you have, and yet you provide such an advanced level of care for patients, which at most centers would be scarce to provide. And even despite it being in a public setting, I think I'm very impressed with the quality of care. I can see the patients are certainly are benefiting from it. They're comfortable, and yet despite being in a resource limited environment, they are getting care which is similar to what we would provide in Canada and the US as well.
I'm not only proud of what Nina and all of you have achieved, but I'm so impressed with the look that all the patients are providing, because the patients appear to be very satisfied, very thankful, very grateful. But more than anything else, as a hospital administrator, I'm very impressed with the cleanliness that you're providing this care in, the sequence in which you are thinking,